please meet the lovely Esme. Esme is a first opinion vet, but she, like me, has got a greater interest in chronic pain, and she has done further training and has been running a chronic pain clinic now for a couple of years, is it?
Yeah, I've gone to do my own business in the last sort of 7 months, but I've been running a pain clinic for a couple of years now, yeah.
So now the secret that is out is Esme is taking my place. So Esme has joined.
No pressure.
She's joined the CAM team, and I'm going to be stepping back from some of these lives. I'm going to slowly drift away, and Esme is going to take my place so that we can do more admin. CAM is growing, and we're now starting to make it more of a sustainable structure. So please meet the lovely Esme.
Hello. It's
tell
very
them a little bit about yourself.
Okay, cool. So I think I came to arthritis in a different way to most people. I think a lot of vets, they gain that interest once they've had an arthritic dog of their own. I kind of got to a point where a lot of my peers in my from my year of university were all talking about doing certificates and things, and I kept thinking, I don't really know what I want to do. And I'd worked at a previous practice with somebody who'd done acupuncture, so I decided to go and do a foundation course because I thought, well, it's a skill, we'll see. And I went and did there's a course with a Western veterinary acupuncture group with this amazing woman called Samantha Lindley, who is like the goddess of acupuncture. And I caught the bug, and within a year I'd done a sort of a safety and competency certificate and then a full certificate in chronic pain management and acupuncture, and it's just taken off, and I'm absolutely obsessed. And my whole day is talking to people with arthritic dogs or trying to teach people with arthritic dogs, and then obviously I've now found CAM, which is my new hobby and obsession. So yeah, I've come to that. I have got doggies, but they're not quite at that point yet, luckily. But it's nice to, I think, even from just like an owner perspective, to start getting things in place where you think, even as a vet yourself, you're thinking, I probably could do that better, or should change maybe how I'm doing that, maybe reduce the ball play and that sort of stuff. So that's why I'm really excited to get involved in CAM.
It's good. It's good. And it is lovely. I think in another Facebook Live, I said how you start attracting people that have the same interest as you. And it was with Donna Wills, the physio, last Friday. I bumped into her at Vet Fest. We started talking. We realized that we had the same passion, and it so tonight what we're going to do is we're going to keep it very, very real, very first opinion. So anybody who is new to CAM and they're thinking, what's this about? We're going to try and keep it real for guys like you. We're going to talk about cases that we've seen in first opinion, and we hope that you will be able to take nuggets of information from that. And then we're going to go and drift into our more focused pain clinics. Now, the reason there's a big difference here, guys, is that in first opinion, a lot of the clients that we see haven't bought in, they haven't engaged, they haven't realized that more can be done. They're being challenged with it for the first time. The vets notice something that they haven't, for example. And they're very different people to manage compared to people that have chosen to come to a specialist, to a focused pain clinic.
Yeah, absolutely.
So you're going to start. Tell me about a classic case that we can all relate to.
I think the most common thing that we see as GP vets is the client that comes in and says, my dog is limping, but he's not in pain.
Yeah.
I think that's absolute classic, because I think because the dog's not yelped, they're not crying, they're still wanting to go on their walk, they're still eating, drinking, everything else is normal. They're just assuming they're still playing, so he's not painful. And that's like a massive myth, really, because there's only two reasons a dog will limp. They're either painful or they've got suddenly one leg shorter than the other through an unknown circumstance. So it's a mechanical shortening of the leg. So I think that's probably, do you think that's the same? Probably one of the most common ones.
Yeah, and it's definitely something that whenever we've done a practice training, by the way, CAM does practice training events. Whenever we've done nurse training, by the way, we do nursing events, and we've had everything cancelled this year because of COVID. So once this crisis passes, please remember that we do attendance courses for you guys. Whenever we've done one of these courses, Generally, at the end, people come, oh, she's gone. The connection's gone. Generally, people come up at the end of the course and say, I don't know how to manage owners that can't see that their dog's in pain. The dog is obviously limping. It's obviously got behavioural change. There's something not quite right. She's coming back. Come back. Here we go. Because of COVID, I think the system's struggling a little bit. Don't worry. So at the end of these courses, people are saying to me, I don't know how to manage my clients when they don't accept finding that I'm presenting to them. So for owners that are listening to this, when we see something and we're trying to broach that topic with you, it's not easy. It's really not easy. And the cogs are whirring in our head of going, how can I break this really gently to them that there is something seriously wrong with the way that the dog's moving, behaving, that I believe is pain related. And I want you, even though you came in for a lump or for a vaccine or for check the teeth, I want you to engage me that this is really important and we need to do something about it. What do you do for those ones?
I always try and give them a circumstance that would affect them, that they might do the same as what the dog's doing. So, for example, with the limping without yelping, it would be if you'd pulled a muscle going to the gym, for example, you'd probably still carry on with your day. You'd do things as normal. You might be a bit stiff. I know if I've overdone it when I've been for a run or something, sometimes I'm a bit slow to go up the stairs. And I might internally be going, oh, this is sore, but I'll probably just still get on with my day, because in terms of how much pain I'm experiencing, it's probably a 1 or a 2 out of 10 rather than a 10 out of 10. So I'm not feeling that affected by it in my life. And I think that's the same in the dog. If it's limping but it's not affecting its emotional state, then it will just carry on with its day as normal. And it also depends how much that dog enjoys doing something, because it may be avoiding doing small things that they didn't even realize it's avoiding doing, but the big things like the walking and the eating, it's still doing because it loves them enough that it's worth going to do that thing over the pain that it's going to experience.
Yeah. I think I take a very similar approach, but I kind of reflected back on me. And now if they're really not engaged, I'll be like, okay, so what do you think about this? Am I in pain? And they generally think this is about my dog, not about you. But they then will be like, no. And I'm like, no, I have back pain, but I have a mortgage and I have to drive to work and I have commitments that I must keep up. But it doesn't mean that I don't feel pain whilst doing them. Yeah. And I quite often reflect back on them and say, do you have pain? And they'll say, yeah, I've got a bad knee, I've got a bad back. And I'm like, you're here. Oh, yeah. You know, dogs are quite the same. They will get on with life even with pain. But it is a real challenge. And I think if you're not a confident person, or if you're time restricted, then it's the sort of thing that challenge can make you go, okay, I don't know where to go from this. I'm going to back off and we'll catch you next time. That's not, is it? Just for people that this resonates with, so you might be a pain practitioner, you might be a therapist, you might be a first opinion vet, whatever it might be. We do little business cards so that if worst comes to worst, you can say, look, I think you should have a read of this. And I'm always available on the phone, by email, and you can come back and see me. But I don't want to let this go, but I can understand we're time limited at the moment. Take this, go into that world, have a think about it, come back to me. My ears are always open for you. So those cards are available. What kind of other things do you see in first opinion that you find?
I think when you listen to people talking about how much exercise they do with their dogs, and there's sort of this hidden external pressure that they should be doing an hour a day of ball throwing, or like 10k walks every day and those sorts of things, they always put me with a little bit of unease, really, because I always worry about what the future is for that dog. And particularly when we're seeing that at the moment, aren't we, with coronavirus, that people are so desperate because you've only got one walk a day, getting in all the hours of walking that you can get, and actually the detriment to that dog can be massive.
Yeah.
Even if the dog probably mentally loves it, physically, even if it's not in the short term, the long term it won't pay off for them.
No, there's a meme circulating around of a dog on the top of the kitchen cabinets, really high up, looking, just going, I don't want to go for another walk. I just want to move. And that's so true. I think in this country, I think in the practices and the areas that I've worked, so I've worked in the South Coast, East Coast, and I'm now up in Scotland, I find that people are over exercising more than under exercising. Both are problematic. We do not want dogs that are left in bed all night, all day, because they're sore. So I'm just going to let them sleep it off. No. But also, I tend to meet people that want to keep that relationship with their dog, and that relationship is that routine, that route. And trying to get people to break away from that can be challenging, or no, I think sometimes people just need permission.
Yeah, I think that's the truth. That really is the truth. Yeah.
Yeah, and it's almost like I, as your vet, am giving you permission that you are allowed to do less. And
yeah,
sometimes you feel that people almost get a bit of relief from it, don't you?
I actually think that is more often the case than not, and I think people feel that, you know, that they'll be a bad owner if they weren't walking their dog at least 2 hours a day.
Yeah.
And that's not always, don't get me wrong, there are certain dogs and certain breeds where that's needed, but in a controlled and sensible, not at 15 years old. And you know, it depends on the dog and on its fitness level and that sort of thing, but in general that's a lot of walking every single day to do.
Yeah, no, absolutely. And as you say, the type of activity, I saw one guy, and his routine with his dog every morning is they got up and went for a jog, and that was it. And they'd done that for probably 8 years. And he relied on it for his mental health as much as anything. So asking him to break his routine was quite difficult. And you could see during our management plan, I kept seeing him leaning back, wanting to go back to it. Don't do it. Yeah, he was like, no. And he was like, can I not? I'm like, no. And, there is a lot of coaching involved in lifestyle changes. And I think a problem with the current first opinion system is we don't have a huge amount of time to coach, basically.
Yeah.
And that's why.
And I think it's often a problem when you've got more than one dog as well, because what will happen is you'll have a dog who's getting older, and then you'll get a new younger dog, and that dog does probably need the exercise that you previously did with your older dog. And it's trying to manage the situation as well, where you want to do justice to both dogs. And I think that's one of the most common things I see, is that some dogs are being overwalked when they're older, just purely because they need to get that fizz out of the younger dog. So that's kind of one of the things I try and strategize with the owner about their lifestyle and how we might be able to change things. Maybe the older dog doesn't go on every single walk, and you split them up into multiple walks, or it's difficult, and people have busy lives, so it's hard, you know. It's all about me saying, well, let's do 4 walks a day of 10 minutes. Well, if they can't fit 4 walks in the day, and they only have that 1 hour in the morning where they can get out, it's tricky, isn't it?
It is really tricky. Sorry for the poor reception, guys. If this is a little bit broken up, then apologies. Be Live, which is the streaming platform that we use, has got a big red sign saying high loads at service providers may cause some performance issues. Our engineers are on it. So apologies. I think it's just that everybody and their dog is now online streaming. I tell you what, if I to hear anybody that's decided to entertain the masses with their singing capabilities, recorder capabilities, the fact that they've just learned guitar, I don't need that at the moment. That's off our platform. We're really important what we're saying. I've got a couple of good questions. What's best for arthritic dogs? Do you mind if I answer this one?
No, that's fine.
The phrase arthritic dogs is very broad. You could have a very young dog that has got very mild signs, or a very young dog that's actually really severely affected, all the way through to an older dog that has got quite severe arthritis with a lot of soft tissue changes and lots of neurological changes, through to an older dog that's coping amazingly well. So it's a very difficult question. have is a little booklet about how to exercise an arthritic dog, which we go through all those different sorts of understandings. We've got a new exercise tool coming out, which is being worked on by the lovely Emma. By the way, everybody that works in CAM is pretty much a volunteer. Thank you, guys. But if you put me on the spot and said, broadly talking, it's walking. It's walking. It's walking.
Yeah.
Full pace walk, slow, methodical, consistent, no breaking into a trot, no lagging behind, a nice, steady walk. What do you think?
I always say my rule of thumb is if your dog has slowed down partway through a walk, that is the point you should have finished your walk.
Yeah.
So had you been walking for, let's say you were walking for 40 minutes, but 20 minutes in, the dog was really slowing down. That means from now on, you need to make your walk 20 minutes. And if that becomes 10 minutes or 5 minutes, that's just what it is. So that's as long as they can cope with. And I understand that some dogs might realize they're halfway round and they don't want to go home because they're having a great time and they're slowing down. But that's where changing your routine and making sure you're using different routes is important, to make sure you can distinguish between pain and choice. But yeah, that's what my kind of rule of thumb is. And I actually think, I think you're right. You touched on it earlier. Every dog that I see, I never say rest them fully. I always say just to the end of the road and back, so they at least getting the sniffs and they're walking. You shouldn't be walking in front of your dog ever. You should be walking beside you or in front of you. And try and limit your walks to what your dog is telling you it can cope with.
Yeah, I've got a quite sad story that people are just going to feel really quite unwell after this. I had one owner whose dog, he misinterpreted his dog slowing down, that the dog didn't want to go home, so he'd walk in further. I was just like, no. So this poor dog. I
think it's hard. And we speak different languages, us and the dogs, and we speak to so many behaviourists on CAM, and it's just so obvious how much we need to learn about dog behaviour, and they actually are desperately trying to tell us things, but we don't always understand what it is they're telling us, and we're having to use like our human intuition on trying to interpret them. And I think that's where the vet comes in important, because we are the dog's advocate. We're doing our best to interpret the behaviours to then speak for the dog to the owner.
Totally agree. Cam's been invited to do a talk at Bristol University about pain and behaviour and pain, and one of the initial slides says, in my opinion, until we learn more about behaviour, we're never going to be able to manage pain. And I think I really feel that, in that if we can really begin to observe these things that they are telling us, we will then be able to catch the signs earlier. We will be able to work out whether our intervention's working. And Bev's got to come back with some specifics, which is great. So thank you, Bev. She's 12, still wants to run, chase the ball. It's running bad for her, very arthritic back legs. I'm worried, I won't lie. And if you, as an owner, and don't take this the wrong way, seeing that your dog's got very arthritic back legs, that means to me that they're probably quite wobbly, they're probably quite weak, they probably don't have the coordination that they should do, they don't have the ability to move and think fast for themselves. Chasing a ball is quite an erratic, high intensity, brain full of these amazing chemicals going, just want the ball and I don't care if it.
So true.
And I would say that the ball chasing for me was no. I would get rid of that. I would potentially start having the dog wait. I'd place the ball somewhere, maybe in some long grass, and say, go find it, to really bring that impact forces down. Just imagine if you're running along and you've got painful back legs and they're suddenly twisting and turning and breaking and bending and going in different directions. That's going to make those joints really angry, really angry.
Yeah.
And then you've got all the soft tissue around it. So you've got the joint capsule, you've got the ligaments, the tendons, the muscles. They're all compromised too, and they're being forced to do this badly. So I would definitely say control needed in that case.
Yeah, absolutely. I think in those cases where dogs are obsessed with the ball, I'd just try and alter the way you use the ball. So don't take the ball away completely, but instead do hide and seek, as you suggested. Sometimes I do sort of sniff it out games, rolling it as well in a very short So if at home the dog's lying down, you're rolling it to them, so they're literally just picking it up. Things like that can be, and using it as reward. So when they do something well, you give them the ball. It's a shame, and it does make their world a little bit smaller because that's one of the things they enjoy doing. But I think half the thing they enjoy is the interaction with you. So it's the fact that you are throwing the ball to them and they're bringing it back to you. So you just have to find other games they can play or other interactions with them where they're getting that same little burst of endorphin and they feel as praised by you for doing something with you. And when you think of it like that, it isn't just specifically because they're running after a ball. It's because they are having that lovely interaction with their owner. And every time a dog releases endorphins, it's natural pain relief, so they're feeling more comfortable as well. So that's what I always say, lots of attention, affection, games where they're not running, twisting, jumping, and there's so much. Cam covers all of the equipment and games and things that there are on the market, and I think so many.
I think, as you say, it's about us vets need to be better at saying, I don't want you to do this because I do this instead. Because I know that a lot of owners, if you've done something the same way for 10 years, suddenly breaking that habit when you don't understand why and coming up with something else is quite challenging. So us vets give more details. We've got another good one here. What about dogs with muscle wastage due to pain? Once they have the pain relief, how to get them fitter again? Ooh,
I think this is a good question. So I do a lot of acupuncture in my pain clinics, so I use that as a really good tool to get them comfortable alongside analgesics, so pain relief drugs. And then when they get to a certain stage, we start adding in some basic exercises, so standing square, three-legged stands, that sort of thing. And when it gets to a point where I think they are coping well enough with very, very basic exercise, I normally recommend hydrotherapy or physiotherapy as an addition. And I think that's really important to have controlled exercise. And you may find that your dog's capability of doing walks is better. So some of these dogs, they're only doing minutes once a day or twice a day, and we might build it up to 10 minutes to 15 minutes, but it's never, or it may be that we're doing 10 minutes 4 times a day instead of twice a day, but everything remains controlled. It doesn't mean that once you started to get them comfortable and they're doing really well that we suddenly start now walk again. It still stays very, very controlled. But I think once you start that kind of multimodal approach, you do have really good responses.
I'm quite facetious when I'm talking to owners about this. And I quite have to say, never seen a dog do yoga of its own choice, have you? And the reason I'm just trying to make it a little bit funny is that because you've taken away the pain doesn't mean that dog's going to go, oh, thank you for taking away the pain. I'm now going to do loads of exercises, rebuild function and strength back into it. Thank you. They're like, great, I'm just going to carry on doing what I was doing. How to run differently. They've learned how to achieve things differently. So yes, there are many ways of improving function once the pain is under control. And I totally agree with you. We have a completely underutilized, skilled profession, physios and therapists that I just don't feel are used to their best. For people that, oh my God, it's the COVID crisis, we can't access them. They are still there offering email advice, telephone advice. They will start on maybe an observational plan so that when the restrictions are lifted, that you go. So they might be somebody that you want to approach. They might give you some reading, might push you in the direction of learning more. They might give you a few very basic exercises to do during this restricted period. You're up and in, ready for when restrictions lift. So because we humanize dogs, does arthritis in dogs similar to humans flare depending on the weather? Yes,
definitely. Yeah, and I think in my pain clinic, because I'm doing regular acupuncture, that's really obvious over winter because I end up seeing my patients more. But I think the great thing we've touched on quite a few times is really the empowerment of the owner to understand their own dog's behaviour. And also I do a lot of education on how the pain, I mean, I'm a massive geek when it comes to how the pain process works and how drugs work. So I try my best to teach the owners that as well, because then they're the ones ringing me and saying, oh, me, it's not you know, he's not done that well this week, or he's licking his paw, which he doesn't normally do, or they know the signs for their own dog, and every dog is different. And I think that, you know, we're talking about behavior earlier, but I feel that I learn with every patient, because every single dog gives slightly different behaviors, or the combination of behaviors. And I feel like every time I treat a case and it improves and that behavior resolves, I learn more and more about, oh, okay, well, I think actually that was pain related. And it's really interesting. It's a massive geeky topic, but it's super interesting.
No, it is super interesting. People keep saying to me, like, you've been obsessed now for about 5-6 years. Are you not bored yet? I'm like, I haven't stopped learning yet.
No.
And I think what is fascinating is that you can learn a lot from textbooks and papers and from your tutors and from your peers, but you learn a lot from the dogs. And the more clinics running and the more conversations that you're having with owners, you just build just this repertoire, don't you?
Yeah,
it's great. Back to Bev. Bev, you're great tonight. I love this. She's a collie, but we'll do hunting thing, no ball throwing, on lots of supplements and CBD oil. We're not going to do supplements and CBD oil and things tonight, because then it will just kick off. We'll do that another time. I just want to talk to you about collie. So I've had collies, and I have a collie now, and I work with a lot of collies. So I work in a vet practice in Scotland, Greenside, and we do a lot of work with regenerative medicine and rehabilitation. So we've got a physio there, we've got a hydrotherapist, we've got an osteopath, we've got 2 vets. You know, collies are insane at putting up with pain. They're very, very focused individuals, and we have a lot of dogs that come in with tendinopathies, lumbosacral disease, you know, significant arthritis, and they're still competing. It's still training. And I just feel it's one of those breeds that really you need to have a clinical examination, understand your findings, and think for them, because they've
got unbelievable drive. You know, they are like one of the athletes of the doggy world. And when you think about like a professional footballer, for example, they will play through an injury because for them playing football is such a passion, and maybe the finance helps as well.
I was gonna say
that might help, but you know, they're going to still play, and they're still going to push through things that maybe they shouldn't, and that will be detrimental in the long run. And they'll have their manager then be really cross because they should have stopped when they were injured and recovered properly. Well, I know that's not quite the same metaphor, but in terms of a collie, they're going to just do whatever they're driven to do, and there's nothing that's going to stop them, even really sore joint. Yeah.
And I have found that, and this is again my learning experience, if I do the clinical exam in front of the owner, I'm like, look, there's pain here, there's pain there, there's pain there. The owner doing it then is willing to change lifestyle, but the dogs are so still able on the everyday walk. The owner just can't believe that there could be any pain there. So collies are a very interesting breed. They are very resilient. Great with the question, guys. Keep coming. This is good. My dog's almost 5, has elbow dysplasia, but also sore back, legs. Just recently got a lot slower, nibbling back legs. Should I rest for a couple of days before cutting down the walks? Oh, nibbling. Oh, nibbling. Oh, nibbling. You're introducing us into a whole new world, which I'm sure that Esme would like to get into.
Yes. So for me, dogs in general, as a vet, if a dog came to me with nibbling its feet, you've really got sort of 2 reasons it's going to do that. One would be an allergy, which obviously this is not going to be that in this case. 2 would be pain, and normally it's a neuropathic pain, so it's a tingly nerve pain, and we're not really sure what we experience because we can't be the dog and experience it. But the dogs that, I think this is common in dogs who've you know, had elbow dysplasia from when they were young. That's, I think forelimbs is more common than back legs with licking in my experience, but you do get both obviously. But they have this sort of repetitive licking, and we used to put it down to an obsessive behavior, but normally when you treat them with some neuropathic drugs, things like pentin and along that side of things, they improve.
Yeah, I think, and this is me just literally thinking on the spot as you were talking about front legs, back legs. I've never really thought about this, but I think it makes a lot of sense to me, and you can see whether you agree. I see lots of dogs that lick joints on their forelimbs because they're accessible, because they're there. But for a dog to twist its back, which will have compromise as well, to turn round, to get to the back leg and to start nibbling, that's a different kind of pain. That's going to be instant, that's going to be sharp. It's going to be, I've got to do something about that. A bit like if you got stung by a bee, like, oh, I've got to do something about that. It creates a different experience that's making that dog willing to turn round, potentially hurt another part of itself.
Yeah.
It's a different kind of pain. And neuropathic pain, I feel, having been one of the people that didn't really understand it, is not very well understood.
Yeah.
What I would suggest, Sherry, is yes, rest, but still keep moving. So cut the walks down a little bit, but give your vets a ring. Are you on something that has got a neuropathic focus? So give your vets a ring. A lot of vets taking emails, phone calls, etc. But we just need to know what it is, where it's coming from, etc. So good points though.
I think it's interesting talking about neuropathic pain, because I think that's one of the least understood bits, as you've said. And I think it's important to know what behaviours they do demonstrate. And I think with a lot of dogs who've suddenly developed phobias, that's a really, really common issue. And like you said, the bee sting, shooting forwards, that's really common. Licking, and sometimes I think the staring off into space can be to do with that as well, because they're constantly this tingling kind of sensation. But I think the phobias one is the one that I think people find hardest to understand. And my way of explaining it is that they experience the pain and they assume it's an external pain because it's been a sharp, sudden pain. And because, so for example, I'm sat in this chair, and if I was the dog and I had sudden sciatic nerve, I'd shoot forwards, turn around and think that the chair had bitten me. And then I wouldn't want to sit in this chair anymore. So then I'll go and sit somewhere else. And it happens the same when they've been started with a loud bang and then they've shot forwards. And now the bang is the thing that caused that pain, the set off of the sciatic or whatever nerve it is that's affected them. And then they create this pain. And I think that's one of the areas that probably we don't notice that much as owners. It's kind of an odd sensation.
Yeah, Holly had that, and I was non-educated when Holly was suffering that. I think it's one of the drivers about CAM is that I didn't know this. My dog didn't have the best care because her owner didn't understand it, and I want everybody else to have a better understanding so they can care for their dog better. But we used to always do this river walk, and then one day there was a bonfire and it started spitting and she must have jerked and gone, oh, I didn't expect that. And she had lumbosacral disease. So she would have more than some shooting pain, associated the pain with the noise. And then that walk was over. We couldn't go along the walk anymore. Complete phobia for the whole footpath. It wasn't happening.
I get a few sort of people coming to me asking me if acupuncture can cure phobias or these sort of anxiety behaviors in dogs, and I always say if it starts in pain and we treat the pain, then maybe, but if it starts through a behavioral issue, then that's a different story, and the acupuncture is going to do absolutely nothing for that, and that's going to require training. So it's an interesting point.
I think that also gives us an opportunity to just say about a conversation that I was having today, which leads slightly into chronic pain clinics, but we're going to come back. Once you take away pain, be it a physical change has happened or a behavioural change, don't expect it to just disappear. You know, it's not a case of, oh, everything's gone, everything's normal. Some of these behavioural responses are very embedded. They're very solid and learnt, and going to just disappear when you go, it's okay now. They have to be unlearnt and other positive behaviours in their place. Lee's just got one. One of my boys has been diagnosed with polymyositis. Do you have any recommendations for this with pain and muscle management? With severe atrophy he has experienced, he isn't showing signs of pain or any lameness, but has gone very weak. It's very difficult, partly because polymyositis is a very broad term. We don't know what's been, I don't know how parts of the dog's body's been affected. There are different syndromes in that. So, and it is kind of not arthritis related. So it's kind of a bit difficult to advise. I would definitely seek the help of a physiotherapist to maintain the muscle mass that you do have. They're also very astute at detecting whether there is pain or not there. I'm quite happy to say that my skills learning about pain detection improved with age and extra courses.
Yeah, definitely. And you might, again, that could be a good candidate for acupuncture potentially, but again, it just depends where they're painful, and it may not be the actual primary muscle that's painful. It could be a compensatory muscle, so you might be able to help pain manage other muscles even if you can't help the primary ones that have deteriorated.
Yeah, because we don't know whether you're talking more like it's a myositis affecting the caudal half of the body and the front end, trying to keep it all together. You might actually have discomfort in that front end. We don't know if you're talking more. Yes, contact us privately, and I'm sure that we can point you in the direction. But if you've got a diagnosis of polymyositis, I would imagine that you're already in the hands of a good vet and who's possibly
very capable.
Yes. The fact that you've got that specific terminology makes me feel quite confident you're in good hands, and you should really speak to them. And physio. I would also suggest seeing a physio prior to contemplating anything harder like hydro. There would be a tendency for people to go, I've got to try and maintain the muscle. Got to try and maintain the muscle. Depending on your dog is, that might just be too much. So see if what is your opinion on canine massage? Well, that's a silly question because I blooming love it. What do you think about massage?
Love it for myself and the dogs and everybody.
I think that massage is just one of these brilliant comfort blankets. It can be very specific with a very skilled practitioner that's able to really use it to its best of its ability and target and potentially push a little bit harder, get a little bit more, but it's also got the ability to be an ongoing intervention that the owners can maintain at home. So you maintain your bond, you're empowered that you're doing something in the treatment plan. And I think as long as you respect the dog has to have choice and be able to leave if it's uncomfortable, you can't really do harm. So as long as you're not trying to do joint mobilizations and you're not doing, you know, stretching and all that sort of stuff, if you're doing simple basic massage and the dog has choice and you're reading what they're saying to you, which is, that's actually a bit sore, don't do that, or whoa, don't go there. If you're reading your dog, then I don't think you can do much harm. Happy with that?
Totally agree. And I think the other thing, we've said this already, but the dog is going to be releasing endorphins. Endorphins will help with natural pain relief. Again, you want to get that natural opioid. So the more nice things you do with your dog, the more happy it feels, the less painful it will be. So if 5 minutes of, I mean, who doesn't want to cuddle their dog? It's a lovely thing to do. And when you're doing something that's a nice process with them that is going to make them feel more comfortable, as long as you're being gentle and doing sensible things with them, then everybody's going to benefit from it, including yourself.
Yeah, hugely important. Sherry Walker is back again. She's not on any medication. Thank you. We'll definitely contact the vet. Cool. That gives me a really good opportunity to just say there's a real tendency to believe that vets only dispense medication. And I defend vets a little bit here. Quite often, by the time that we see these dogs, they're very progressed because they are amazing at coping. So by the time that actually they overtly show you, such as a leg or scuffing of the toes, you know, stumbling, there's been quite a lot of progressed change. And when the vet ends up, you know, palpating, like, actually, the only thing that I feel is going to get on top of it is going to be medication. Then the conversation should be had if the pain should be working. We should be minimizing the things that are making it worse, such as the ball throwing, the frisbees, the jumping in the back of the car, doing the stairs, the slippery floors, the jumping up and down, the sofa, running after the pheasants, all these things, the weight control. I would like to think that we can start coming off of the medication because we've now got our lifestyle under control. Do you have that conversation?
Yeah, and I think I'm very pro medication in the first instance. So to get pain under control, there's something called central sensitization, which we touch on in CAM all the time. But the brain like processes all the pain that it's feeling and it becomes its own disease. So I think it's important in when we're talking a severely painful dog to get that under control as quickly as possible. So I have the privilege of having quite a long time to chat to owners and be able to decide, what pain is it feeling and then address those areas of pain. And once we've done that, then the plan is to try and get them off as many medications as you possibly can, not being scared if it needs lifelong medication, but you should always have anything, any drug, any medication always should be given at the lowest effective dose. So that's something that most vets will live by. And I think not to be scared of using other practitioners. I am a vet acupuncturist, so you might think, well, she's only going to want you to just have acupuncture and that's it, which is not the case at all. I would always want the dog to have the best possible treatment it can, and it may be that it has a course of acupuncture with me and then it goes off and it just stays seeing the physio, or you have to just decide what you in each instance, what's the best for that case. But I wouldn't be scared of trying pain relief in the first instance and then weaning off.
And I think that is another really big underlying reason that CAM exists. CAM is willing to do these lives, CAM does these conversations, is that our intention is to try and get the public receptive. So when you go to the vet, they say, I understand I need to try this, this, and this, and I might need to explore this, help me. Rather than what happens quite a lot, guys, which is, imagine me now, table in front of me, owners come in with their dog, and the owner's face is, and me as a vet, I'm going, so we could try this, and the owner goes, right, okay. Or we could try this. Right. Okay. You're like, oh my god.
It's hard because the vets, most people that come into the vets are already a little bit worried, so they're a bit stressed. So they come in and they're not necessarily giving you their normal selves. It's an unusual situation. They're really worried you're going to say something negative or judge them or whatever their worry might be. So then when you speak to them, I think some people are taken a little bit aback and they're not really sure what you're saying, and it takes them a bit of time to process. And I think like the takeaway message for other vets would be to make sure you're talking to them and not be afraid to book them in again to come and speak to you and talk these things through. What you said, write things down. I love my clients are probably bored to death of me writing stuff down and then giving it to them, but I think you go into the consult when you're the client, you're so worried about the dog that's in front of you, and they're saying loads of stuff to you about medicine and drugs and side effects and whatever it might be, and you just come out thinking, oh god, I've got no idea what she just said. And I think that is the point where, as an owner, just don't be scared to call the vet and say, I have no idea what you just said to me. I can't remember what you suggested. Was I supposed to do this? Can I have an email just to ask you some more questions again? I was just going to say. I think that always have have really good open communication. And I am very close to my clients because I spend a lot of time needling their dogs every few weeks, and they know that because I've spoken to them so openly about everything and tried my best to educate them, that they can just ask me any question they need to. But it's trying to get that rapport in the first place.
And you can ask for notes. So I was speaking to a lady today. We spent 15-20 minutes on the phone talking about their case, and then I said, are you okay with that? She said, I don't think I'm at all. And I said, do you want me to cut paste my clinical notes and send it in an email? I'm quite busy today, but I can cut paste my notes, put it in an email. She went, that's great.
Yeah.
Ask for things like that. But I think my little Mickey taking is go in with an open mind, because that vet behind that table is actually really trying to give you options, and it's very inhibiting for the vet when people have no facial expression, they don't seem to be engaged, you don't know whether they want you to help them, and there is a tendency for vets to go, okay, here's a medication, and I guess there's nothing more to want. It's a two-way street. If we're going to make a difference with this disease, both parties have got to play their role.
Yeah, absolutely.
Luke Goodwin. Hi guys, my Jack Russell was having, oh, let me put that back on screen, was having cartridge ven and was due another loading dose. Can't have that at the minute, so using Galliprant and Partway V. Has advertiser with, has that once a fortnight and Hydro once a fortnight. Any ideas of what I can do at home? Is it worth buying advertiser? You're probably speaking to the wrong person, because I'm not a fan of LED light therapy, I'm afraid. There is a very good Facebook Live with David Somerville from a fair few months back now. And he was saying, yes, you know, LED therapy can have a beneficial effect, but you're going to be taking a really, really long time to get the amount of energy into the cells. So it's all about getting energy into the cells at the depth that you want them to be working. So LED lights aren't very powerful, so they're only going to be really working quite superficially, and they're not going to be pushing much energy into the cells. So personally, I'm not a big fan of LED light therapy, but other people might be. What's your feelings?
I've never used it, and I think that's I couldn't really comment because that's not something I'm really that used to using or know anybody who uses. So I think you would, as you say, have to have a listen to experts and see what they recommend.
Yeah. It's really difficult because none of us want to poo-poo these interventions. That's not the intention at all. We want you guys to be able to get things that you can use immediately. Unfortunately, it's about having evidence, and there isn't a huge amount of evidence with regards to LED lights. So what can you do instead? Right, so different vets around the country are doing different things with Carchafen. Some people are allowing owners to come in with their dogs and do a quick jab and go. So at the moment, my practice, we will take the dog from the owner in the car park. We will take it into the practice. The owner stays in the car. We will do what we need to do. We take the dog back and we speak by phone and we pay by phone. And if the dog was on a course of Carchafen, we would continue it. Recently, so I've had a diabetic dog recently that was also on Carchafen, and because she was happy to inject, I drew up and let her Carchafen at home. So do talk to them about that. Galliprant, yep, brilliant. We have found that it might take a little bit longer to really kick in. So from watching people's stories from Holly's Army, we were a good 3 to 4 weeks before seeing effect, whereas Pardel, the paracetamol, we know is a bit more speedy to get a kick in. So I use it a lot for acute flares. Do you?
Yeah, I love paracetamol, massive fan. I think I spoke to Luke on the Holly's Army for a little while about his dog, but yeah, I think it's I think having that is a nice broad spectrum of drugs they're using there to target 2 different pain groups. So hopefully that will keep them nice and comfy, and then we just have to hope that this will all be lifted soon and you can get back to the normal routine and more options will be available at that point.
Yeah, and your physio, hopefully your physio is doing home exercise plans. I know that the physios at where I'm working, and a lot of people on the CAM team are physios, they're doing a phone service, an email service. You know, a lot of people setting up video consults as well. So Bev Thomas, been a star. My vet suggested laser treatment, but obviously can't start it at the moment. Thank you. Well, yeah, laser in the right hands can be very effective, but you need to know what you're treating, what depth it is, what kind of pain it is, to make sure that you've got a really good clinical examination there. Might pay for a physio consult prior to going into laser. What do you think about that?
Yeah, I think so. I think laser is like a nice adjunct to other therapies. So I quite like it in terms of, especially with a dog who's needle reactive, that might be a good circumstance. I would prefer acupuncture. I find it's more potent. But that's just, obviously I'm going to have a preference because that's what I do. But then I find there's some dogs, so who, you know, aggressive dogs maybe, who don't like being touched, they'll get used to the laser quicker. And I've had some good results with patients I've referred for laser as well. So I think it's just finding the right combination of treatment. But I think going for a combination approach is always the best thing to do.
Definitely. Luke's back. Also, how often would I need to do it, and how often is appropriate massage wise? What would you need to do? Are you talking about the physio? Physio, if it was a home exercise plan, generally it's a daily intervention. Short, little targeted exercises, you know, reps of say 5 to 10, and doing it say 2 to 3 times a day, choosing maybe 5 exercises that target what we want, whether it's improving range of motion and function, or strength, or inducing like relaxation and improving, you know, suppleness, etc. Massage, depends what kind of massage. If you're going down deep, then I wouldn't do it more than once a week. If you're doing a nice light superficial massage, you could do that up to daily, but it depends on what you're doing with the tissue. Again, happy with that?
Yeah, and I think the one thing that you could do is, massage a certain area and then later in the day massage another area, and just keep them very short sessions if you're just doing a light, gentle massage. And don't forget that stroking your dog is also going to help keep them comfortable. That'll be an enjoyable experience for them. So even just normal petting, gentle petting of your dog, they'll walk away if they don't like it.
No, definitely. Lee's back with whole body. They originally thought it was mastocytic myositis, I should imagine. So again, I should imagine your dog's probably on steroids and other immunosuppressants, which are going to be affecting muscle. So they are catabolic. So you will find that you will lose muscle mass because of the steroids as well. So I would be definitely working with my vet, trying to make sure that I'm getting onto the lowest effective dose of the immunosuppressant as quickly as possible. And then I would be employing the help of a physio, definitely. But that's not my area of expertise. I'm happy to go and have a read around it. If you head over to either Holly's Army, or if you go to cam-foundation.co.uk, it's a forum that we run, and we can answer more specific questions like that. We try and make sure that we answer things in public so other people can benefit. I'm sorry if this is a bit off topic, but I feel so overwhelmed with all the different ways to treat arthritis. You're right. Yeah.
It's overwhelming.
It's overwhelming. And Phil, my vets are just all about medication. My dog is currently having a flare-up and is on Metacam and gabapentin. Do I wait for him to get over this flare-up or get more meds? Okay. I'm happy to talk with you. Do you want to do this one? And
I don't mind. You jump in and add bits in. I think it's really, really tricky. And I think at the moment as well, it just depends on the situation, because we are seeing a few clients who, because they're at home with their dog, are finding it more stressful and maybe interpreting things more. So I would have a really, really good chat with your vet. I would ring them and talk about all the things you're seeing with your dog. And if you feel that the pain and management isn't enough, it may be that they can increase the frequency of the gabapentin, or they may be able to add something extra in, or it may be like reducing what you're doing. But I personally would have a really good chat with your vet, because they probably know your dog better than, well, obviously better than we do. It is, I think the other thing to touch on is it is difficult, because me and Hannah are obsessed with arthritis. So our area of expertise is arthritis. But that doesn't mean that every vet is the same. And for example, I'm happy to see basic eye cases, but I do not know a lot about ophthalmology. That's not my area. And if somebody comes to me with a patient with an eye condition more than a basic ulcer or a bit of conjunctivitis, I'll go and get my boss or a colleague who's really good at ophthalmology to see that case. It may be that you might just need to speak to your normal vet, chat with them. If they aren't happy, they should let you know, and they can refer you on to someone else. And it may just be that you sort of need to have a chat with someone else if they're not happy with managing other bits or pain management. Is that fair?
Yeah, I think definitely a couple of things that are happening at the moment. We don't know how long this crisis is going to go on for, and vets have got some serious restrictions have been placed upon them. We cannot see non-emergency cases. We are being watched like a hawk. We have to behave professionally. So some vets, and I know that this is in the back of my mind as well, is I know that owners quite often aren't great at detecting pain. Sorry guys, but it's really, really true. And if I have got a dog that's showing signs of pain, and I'm saying to myself, well, an acute flare, 7 to 10 days, oh, I'd really just like to give it 7 to 10 days of acute flare on top medication. The other part of my brain is going, actually, if this dog is really quite sore and we've got another 2 months here in this crisis that I can't see it, how I then have a seesaw in my head of pros and cons, and I'll be probably saying to myself, well, I'm going to let the medication I've added last a little bit longer, because I want to make sure my priority is the dog is not in pain. Trying to minimize the length of time the dog's on pain relief. So that's one thing. Next thing, as soon as someone says acute flare, I go, what started it? So why is having a flare now? Has something happened? The sort of things that I see are people have changed their sofa and they've gone from a low sofa to suddenly a high sofa, and the dog has jumped on and off of it and it's flared its elbows up. Or I've had people that have had DIY work in the house and they've lifted up the floorboards and the dog's tripped and stumbled. Or the dog's been out and the owner's been on their mobile phone to their mum who's just been taken to hospital, and they've been flicking the ball thrower, and suddenly 30 runs later, the dog's like, I'm really sore.
Yeah.
Look at why your dog is having an acute flare, because quite often you trace back to there being a trigger and deal with it, okay? Yeah. Don't forget things like heat packing. Don't forget things like simple massage. Think about basic walking. Walking is a very powerful reliever, distraction, enrichment, muscle trainer. It's a really powerful exercise. So get them up, get them out walking. You know, watch for them when they're really beginning to fatigue, but get them up and get them walking. Get those joints moving and lubricated. But definitely have a chat with them. Yeah, Luke says, hi, Eden. Esme, you're Eden now.
That's okay, I'll take it. I've been called worse.
Yeah. You should see, we've got somebody on the team called Lindsay, and we all irritate her by calling her Leslie. Right, Emma Louise. I also think people bury their heads in the sand because insurance stop or cut down paying out as dogs get older. There is a very big financial element to this. And again, I am going to big up Cam. We're trying to do a lot. We're trying to provide you a service to open your mind to what is available, open your mind to the signs dogs present with pain, physically, emotionally, behaviourally. But we're also trying to dampen the cost for you as well by making sure that you have the foundation in place. So instead of you going to the vet and having a whole consult about the weight of your dog, you go to the vet and go, my dog's on a weight loss plan, what else can I do?
Yeah.
Instead of you going to the vet and the vet going, would you like to stop throwing the ball and letting him jumping out the car? You can go and go, I've stopped throwing the ball, he's stopped jumping out of the car, I think I've got that sus, but I still have pain. What more can I do? So Cam is trying to do a lot for both vets and owners. So well done, Cam team. Well done.
Yeah, definitely.
We're on top of some of the questions. So let's now go for a couple of minutes into a chronic pain clinic situation where the owner's engaged. Can you give a classic case?
Yeah. So I think often this is something I'd like to touch on is dogs with behavioural changes, and we've decided that it's got some, we call it cognitive behavioural dysfunction, but it's a bit like Alzheimer's for doggies. So they go a bit bizarre in their old age. They're doing pacing around at night, vocalization, staring at walls, sometimes deafness, although obviously you can get physiological death as well. Maybe being a bit picky with food, that sort of thing. That's often what I hear, and they've come to me because the dog's clearly painful in other ways, so not able to do the stairs, not able to jump up on sofas, slow on walks, maybe not playing anymore. So the really obvious things they've seen, but those subtle signs, which maybe have been either put down to just old age or whatever the case may be, they're there as well, and they're the ones that I actually worry about more, because that's the ones I think is more associated with the emotional suffering of the pet. And they're the case that is actually the hardest to get on top of, because you've got to try and work out all the different sections. Have you got neuropathic pain? Have you got nociceptive, so muscular soft tissue pain? Have you got nociceptive inflammatory pain, so joint issue? Have you got emotional suffering? And then you've got to try and target all of those areas and reduce any central sensitization. And it's a difficult one. And I think the great thing is, as you say, most of these clients have already, they might be a member of CAM, they maybe have seen other vets already, and they've started the pain relief process off, and they're already on board. And what you'll find is a lot of those people have had chronic pain themselves, so they have some kind of emotional understanding of how terrible it makes them feel, so they're desperate to get their dog's pain under control.
Sorry,
and they're the ones that They're the ones actually in some ways are the easiest to get on top of, because the owner is so engaged. They're happy to do whatever you would advise, and compared to the case we were talking about earlier where the owner's not engaged, they're brilliant because they're really on board. But it can be physically harder to manage because the dog's in so much pain that you're having to really alter how you do your treatments. And I'm lucky that my treatment is quite enjoyable for dogs, so often it'll give them 20 minutes of real pure joy, and they'll fall asleep and relax for the first time in days, while I'm trying to talk to the owner about all the different things we can do and need to change, and maybe need to contact a physio and all that sort of stuff.
I think you've made a really valid point, and I'm going to try and illustrate. I've been a vet for 18 years, and when I first qualified, in a 10-minute consult, I would be expected to vaccinate anal glands, clip claws, and deal with the dog's aggression. And, that would be totally acceptable.
Yeah.
I worked in the back end of Yorkshire for a while. And now, no way would you ever deal with behaviour like that in a clinic, small, short consult. Yeah. We've seen behaviour as a discipline bloom and blossom into a completely well-respected, your dog needs to see a behaviourist, and you need to have a behavioural consult, and you're going to have a behavioural report, and it's going to be followed with follow-up. And I see the same happening with chronic pain, personally. I think we are an explosion of specific clinics. We're seeing it happen in referral centres. Nearly every referral centre in the UK now has a pain specialist doing outpatient clinics. We're starting with small animal practices where we have a vet in the practice with a specific interest in pain management. And I might even turn into a mobile service for a lot of people, because dogs will express themselves better in the environment. So I think it's a really, really exciting time. And I think owners who are concerned about their dog being in pain should start asking for more.
Yeah.
Because ask, your clinic will provide. That is how it works. With a dog coming to see us, we immediately know that there's going to be a multimodal management plan that comes out of that consult. And we will definitely be looking at the dog medically, but also physically, and be involving other therapists with other skill bases. So yeah, chronic pain clinics are, I'd say, having that engaged owner, we can do so much more.
Yeah.
We're at 62 minutes. Have we got many more people? Elaine McKenna, here. Cam team are amazing. Well, thanks, Elaine. That's so. We're going to do 10 top tips.
Okay.
I'm going to let you lead. You can do number 10.
Okay, number 10. Any change in your dog's behaviour that could be a sign of pain, so see a vet.
That's just it's true though. And when we go out, I bet you're the same. You're like, oh, that's probably got pain. Oh, that's got pain. That's got pain. Pain.
It's very obsessive. Yeah, it's very obsessive, unfortunately.
Yeah, don't ever come in a car with me, because I'm like, dog's not walking. That dog's got poor posture.
Yeah, I'll tell you a very quick story. But at Christmas last year, me and my husband went to like a nativity scene thing at a local farm, and there were reindeer there, and the first thing I did was go, well, look at that terrible diarrhea, and he just turned to me and said, I just ruin everything because I just point out all the disease I can see. Yeah, I do.
I know. On the similar light, I think it was one of the big Sunday newspapers did this whole beautiful pictorial section about dogs and dancers. So they had ballerinas and ballroom dancers, and every photo had a dog in it. And I was like, that one's got poor posture. That's got pain. That's got pain. Yeah. My friend was like, why'd you ruin everything?
Yeah, just ruin it.
Ruin everything. So number 9, we're seeing a lot of people online talking about how much they're eating because they're restricted at home. Don't let your dog do the same. Ration what you're going to eat that day, put it on the side, and that's what you're sticking to. If you choose to feed them 1 kibble every 5 minutes for a 12-hour day, and that's how you want to feed them, then that's fine. But don't start reaching for more stuff. We do not want to come out of this pandemic with a bigger obesity epidemic.
Yes. And number 8, kind of following on from that, just because we can only walk the dogs once a day doesn't mean you need to increase your dog's exercise for that period. So try and keep what they've always done very consistent.
Good one. And follow on from that, if you're used to walking your dog 3, maybe even 4 times a day, think about those other 3 occasions and do something in the home or the garden. Yeah. Just because you haven't gone out for a walk doesn't mean that you can't do stuff at home. And I think that's been really well illustrated by the people that are doing crazy stuff, like a marathon in a postage stamp garden. There's a guy that climbed Everest up and down his stairs, and he walks up and down his stairs for something like 5.5 hours continuously. I think that demonstrates you can still exercise in your home. It's not for me either. You can still exercise in your own home. So if you have a routine of getting up and going for that walk, still improve your mental health by doing something engaged with your dog with a physical component in the home. Number 6.
I think 6 would be not to be afraid of speaking to your vet when there's an issue with your dog. So if you've got something you're worried about, just pick up the phone. And even if they can't speak to you then, maybe drop them an email instead so that they can get back to you when they're free.
Yeah, good one. Number 5 is Hannah Blunt Pants. We've created a massive amount of information for people. There is a YouTube channel with Facebook Lives that I think I've been doing for nearly a year now, at least one a week, with key opinion leaders, academics, professionals. You can learn so much. There is a website with 100 pages. It's full of conversations where you can do keyword search. There is a Facebook page that you're watching on, which has been going since 2015. There is Holly's Army, run by Canvassadors, who are insane. They're such good folk who have private education so they can oversee that forum and keep it safe. There's the cam-foundation.co.uk. Guys, dig in. I think it's quite heartbreaking to see people just join and instantly say, my dog's in pain, what should I do? I'm like, good God, there's go read. The reason I say this is a lot of vets are very, very stretched at the moment. A number of practices have had to furlough a lot of their staff. A lot of practices have had to close all their branch practices and they're working just from the main branch, and therefore they're reduced staff. Very stressful environments. A lot of us vets do phone and video consults, which we've never done before, and they're very, very stressful. And after a lengthy phone call, we then have to write your notes up, which adds a huge time load. So going to your vet when actually the information online is there presentable for you, please use it.
Before you carry on, be kind to them as well. They are human too. I can tell you I'm furloughed at the moment, and as a human being, it's a worrying time for all of us, not just, and you still working, you're on effectively the front line still. So either way, it's stressful and scary, and we are still trying to do our absolute best for all the pets out there. So just be kind.
Be kind. Number 4.
Number 4 is spend time with your pet. That sounds very silly, but often when they get older,
say that again.
Spend time with your pet.
Yes.
So when they get older, they take themselves off and they'll go and sleep in the corner, and they're not as keen to play, or they don't do as much with you. Go and make the effort to spend some time with them. We're at home all the time. Well, I am at the moment, but you're at home more. Use this as an amazing opportunity to go and cuddle them and sit with them and stroke them and spend that bit of quality time, because sometimes they're taking themselves off because they're feeling a bit depressed, and you being with them will be nice support for them too, and it's nice for us.
That's a good one. Number 3 for me is open your mind, guys. I have people that come in very, very blinkered, and they really still believe that popping a pill is the only way to manage pain. That is date. That is long gone. We know that that is not the way to manage many diseases, nearly every disease.
Yeah.
Change has a massive impact. Now I'm going to illustrate this. I've got quite a bad back. I've got, uncomfortable hips. It's all soft tissue based because I've gone from being very active and consult services to very laptop based and a lot of driving, and I've created my own pain. In the last few weeks, I've really got into my exercise again, and that pain has lifted substantially. Now, it applies to a lot of the dogs that we see, is that it is arthritic pain plus soft tissue pain. So lifestyle changes, these walking, these keeping them active, these licky mats, these games with the recycling, the hide and seeks, good, so sensible. And you want free of charge, and you want things without side effects, please use them. Number 2.
Back to what we talked about at the very start of this. If your dog is limping, it either has suddenly developed a very short leg, which I doubt, or it's in pain. But I know that's a bit not a nice way to put it, but if it's limping, see a vet.
That's a good one. Yeah. Number 1, I've done this one a few times, but I think it's really important to me. There was a time that I really didn't know very much, and I still have a lot to learn, but I really didn't know very much. And I had a dog that I loved, and everybody that knows me, that Holly was my best mate ever. And now that I know what I know, I feel that I could have done more, and I could have done it better, and she could have had a better end of her life in the last few years. What does that mean? It means tell other people what you know, so they too can be enlightened earlier, and they can learn things and implement them sooner, so that all of us can look after our dogs better. The program and the hashtag Your Dog More Years is to make sure it spreads. We want people to learn from each other so that globally we can manage our dogs better. And this applies to cats, and it applies to other animals as well. If we've got any cat obsessives out there that just happen to have the odd 20 grand that would like us rebuild cam for cats, totally in there, totally in there. But this concept applies even to humans. A lot of what we're saying makes sense for humans. Got one more question here. Hannah Capon, do you think we will see rheumatology specialists in vet med, in human consultants lead chronic pain management programs for joint diseases, etc.? How do we get to share these specialists across? I think that's a really good one. Yeah, that's totally true. I went to the Royal Society of Medicine. They did a lecture about chronic pain, and the people lecturing were originally rheumatologists that had to learn how to be chronic pain specialists. And I totally agree. At the moment, and correct me if I'm wrong, there is a needing of a bit more network. We have our orthopedics that are really still linked to being the arthritis people. And we have pain specialists, them, European diploma holders, pain specialists, the acupuncturists, got our physios. We need to blend them, and maybe, yes, eventually it will lead to a single discipline. What do you think?
I think that's absolutely the truth, and I think it's happening slowly. I think more vets are talking to more physios, who are talking to more hydrotherapists. I think we are slowly starting to work together more, but there's not that much out there yet. We're still learning this whole area. I mean, Hannah's one of the front runners in this. People weren't interested in arthritis, and even like I can tell you a story just to kind of put this into words. So I got a cat when I was a kid called Jake. My parents got him from the social services, and he came from a house where somebody had a drug abuse problem. So he came to us with loads of behavioural problems. He was quite aggressive. He was scared of doorways. He didn't like being touched. If you touched anywhere other than his face, he would attack you. And I mean, really attack you. He was like a 6-kilo cat, not fat. And we had him for years, and I'd done vet school, qualified as a vet, and still this is Jake, he's my family cat. And then I went and did my pain course, and then I realized that probably he'd been in pain all this time, put him on pain relief, and suddenly we had this really lovely cat at home. I think problem is we just don't understand pet behavior. We don't, even as vets, we're learning all the time. You know, a few years, 50 years ago, dogs would have been kept as like just the family pet who would have been fed scraps or whatever, and they wouldn't have lived as long as they do now. And people would just put things down to, they're just getting old. And now we're learning more things, and as more of us get more qualifications in pain relief and acupuncture or whatever it may be, we're going to discover more things and work together as a team. And I think I mean, you're doing an amazing job, and hopefully now I can carry on the mantle of increasing this networking and getting people to learn together and appreciate each other's skills as well, because I think that's something that I think people are scared of, and I think there is worry for competition, even on just if I treat them, are they going to go to somebody else? And there's a worry out there, I think, between practitioners.
There's a lot of worry.
Yeah, I think if we work together, you'll get the best outcome and the happier client and a much happier pet, which at the end of the day is the most important thing out of everything.
That's the most important thing. And we were talking about that earlier, that this is about the dog, and then it's about the owner, and then it's about us. And we, what we want, etc., is actually at the bottom of the pile. This is about the dog. And if we can put away egos and fears, and a lot of people have quite a lot of imposter, and they're worried that they're going to be told what they've done is wrong, which can lead to them not collaborating for fear that somebody else will critique them. That's got to go, so yeah, hopefully in time we'll get there. Thank you. So I think she did amazingly well for her first one.
Thanks, guys. Thanks for having me.
So Esme's going to take over as of next week. We've got James Hunt with us tomorrow, who is lovely. So I can't wait to speak to James Hunt again. And then we have got an all-time epic on Friday, Duncan Lascelles, who is god of pain. He is just an absolutely blinder of a Facebook Live. So I hope you join us on Friday. And then Esme next week is running the show. So... And we will see you again soon. Thanks for all your questions. If you've got any more, put them below. This will be available always on this page, or it's going to be transferred also onto YouTube. You can find it there too. See you later, guys.
Thanks, guys.